It sounds like that they are ready to pass these laws without consideration of the pain patients.
The state's attempt to pass new laws to cut back on the opioid crisis also affects patients who use these drugs responsibly and rely on them to survive day to day. As Governor Ducey calls a special session to fast-track bills aimed at saving lives, ABC 15's Sonu Wasu looks into who this will help and who it could hurt.
I think I was addicted after the first pill because the next day I wanted another, and then it turned into heroin. And I started smoking heroin.
Brooke Martinez falls into the 75% of people in Arizona whom the governor's office says gets addicted to heroin after experimenting with prescription painkillers first.
When I wanted something more, something better, the pills weren't working for me anymore. I felt that they weren't getting me high, I guess you can say anymore. And so heroin was stronger.
On the flip side, another group of people who also rely on prescription painkillers every single day, but they're not addicts. There are people like Barbie Engel living with chronic pain.
On the bad day, the pain feels like burning fire pain, like somebody put lighter fluid on me and caught me on fire.
Barbie Engel is an advocate for Arizonans who do live with chronic pain.
We're not crushing it up, we're not snorting it, we're not doing all of the illicit things that you would expect with an addict.
She worries fast-tracking the changes shortcuts public input, leaving people like her in need of these medications forgotten.
If they can pass this within just a few short days, then our voice really doesn't matter.
So here's a layout of the changes. If you're a new patient, a first-time user of pain medications, there's a 5-day limit on your first fill, 14 days if you've just had surgery. We did reach out to the governor's office with these concerns. We're told these laws do have some wiggle room for doctors, dosages, and limits to make sure pain patients will not fall through the cracks.
It has been 7 months since Governor Ducey declared the opioid crisis a public health emergency, and I sat down with the governor and state health officials today. Health officials now say they have a better handle on the problem and more real-time data, but this is just a first step.
We knew that our data before the emergency lagged 4 to 10 months behind. So if you're going to make any improvements and track it, you're not going to be able to do that with those kind of numbers.
The new legislative package also has a Good Samaritan law, allowing people to call for help in an emergency without having to face criminal prosecution for drug laws. At 6:30, why the governor says we need that trade-off.